very much for joining us for this edition of Clerkship Updates. Up next, we have an esteemed guest from one of our specialties whose work has been in very high demand lately. Please welcome our plague doctor here to answer any questions about all things plague. I'm your host, Daniel Harris, signing off.
Hi, we'd like to thank Dr. Steffies for sitting down with us today to speak with him regarding his role fighting the coronavirus pandemic.
Happy to be here.
So we'd like to start out with the obvious question. Your services have been needed a lot more significantly in recent times, right?
Absolutely. The COVID-19 pandemic has really demonstrated the weaknesses of the American healthcare system. We're seriously lacking in plague specialists. We've seen an absolute drastic increase in the need and desire for herbs, minerals, and crystal therapy in the treatment of the coronavirus, and very few individuals are trained in these arts. Good morning, Mr. Avery Anderson. How are you doing this morning?
Doctor, I'm having a lot of chest pain today. Do you think I'm having a heart attack?
The heart isn't real. The Roman Church has banned autopsies. You probably have ghosts in your blood. I'll have the nurse bring some cocaine by later. Nikita! Have you checked this patient's hemoglobin? I believe the red humor may be low.
Now, what makes your training stand out in plague fighting versus traditionally trained doctors?
In times of plague like this, traditional medicine is unhelpful. Vaccination, antivirals, intubation. They just don't treat the ignorance and fear of the plague the normal American has in a time like this. My studies have shown that only 80% of individuals treated with a cocktail of coriander seed and essence of snake oil die, compared to 90% of those treated with hydroxychloroquine and bleach.
Wow, those are fantastic results.
Thank you.
Excuse me, sir. Sir, can you put your mask on?
Doctor, could you tell us how you've been incorporating the study of plague medicine into Wayne State's pre-clinical curriculum?
Certainly. Upon review of the first and second year's curriculum, I found that there is an alarming amount of pathophysiology and anatomy taught. Plague medicine admonishes the banned practice of dissection and the witchcraft of physiology. Students need to focus more on the balance of the four humors, aligning the mind, body, and spirit, and understanding the pharmacology of essential oils. I hope you students are studying your herbs and essential oil. Oh, witchcraft!
Doctor, I know you really have a passion for medical education as you're a clinician here at Wayne State. Could you tell us how withdrawing students from clinicals has affected the day-to-day runnings of the hospital?
Absolutely. We really missed having students on the floor with us earlier this year. Running the plague service takes a large effort from a whole team. I've had to resort to using plague residents to retract for me in the operating room this March. In the name of the Father, Son, and Holy Ghost, Nicholas, drink the patient. Bobs, can I have time out, please?
Yeah, hear ye, hear ye. This is Avery Anderson, date of birth 6/6/69. Last four of the MRN are 8235. Here for exorcism of the medial thigh. ASA is 2, fire risk is 0. Do we all agree?
Agreed. Knife, please. Please position the patient. Please pass the tools. Nicholas!
Sorry.
Count Cryer!
Gloria me pseudolosita me consora viselidum compana vira et mostera vita spira gloria me studio espet consitura spirina.
The past several years have been the best in my life. I hope that the modern public continues to distrust modern medicine. I've made so much money over lack of vaccines. I wish there was a plague every year.